All right. Now, look, those of you who are listening, there are plenty of issues that come up, and one of the issues that comes up all the time is how, Jeff, do you know that you should pick somebody, that you should see somebody professionally, and then even more challenging, how do you know which professional to see? There are all kinds of different forms of therapy and so forth. You wrote a book, Therapy 101, A Brief Look at Modern Psychotherapy Techniques and How They Can Help. Who'd you write it for, and how can you give us some guidelines here?
Well, I wrote it for the average consumer of mental health out there. There's a lot of confusion out there. There's a lot of confusion about exactly what you said. How do I know that I need help? And as your last guests pointed out so wisely, is your problem interfering with your life? We all experience anxiety at some point. That's normal. And we're all going to feel a little nervous or a little sad every now and then, but does your anxiety and does your sadness last for a period of weeks or months such that it's starting to interfere with your job, with your relationships, with you getting out of the house and doing the things you normally do?
Functional consequences.
Functional things, exactly. So if it starts to interfere with your life in that way, that's probably a good time to start looking for help. Now, your other question, how do you know what type of mental health professional to look for, whether it's a psychiatrist, a social worker, or a therapist?
Or a therapist with this particular school of therapy, that particular school, this religion, that religion, you know.
Yeah, there's a lot. Most people don't know that there's over 100 different types of psychological treatments out there, different types of therapies. And
101 because another 5 minutes has just gone by. They keep on developing all the time.
I'm sure there is, especially probably coming out of California, where there's a lot of But so how do you know? Well, you can start off by asking your primary care provider, whether it's your psychiatrist, your nurse practitioner, your MD, if they know of somebody. Or you can ask if you know of a friend who's been in therapy, ask that person. And what you want to do, looking for a therapist, I tell everybody, looking for a therapist is like buying a used car. Don't assume that the first person you go to see is going to be the right fit for you. Throughout research, we know that the most important element of any type of successful therapy is a good relationship with your therapist. And so you have to go in, you got to kick the tires a little bit. You have to set goals, talk with the person, see if he or she feels good. Is this a person that you can trust? Because you're going to be talking about a lot of that.
Assuming, first of all, that you've screened with regard to credentials and, the bona fide person, with the appropriate training and so forth. The analogy I've used is it's like finding a good plumber. How do you find a good plumber? Well, a little bit through trial and error, which is what you're saying. Right. You have to shop around first before you can settle on one.
Or you ask your friends and family members for recommendations. Right. And your first step in finding a good therapist is to make the initial phone call. Let's say that your MD has given you a referral or your friend has given you a referral. You call the therapist and you spend 10 minutes on the phone with that person. And you describe your problem. You ask the person, do you have experience treating problems like this? If the person says no, ask for another referral for somebody who does. And then if the person says, yes, I do have that type of experience, ask the person, what type of treatment would you use? Can you describe the treatment that you would use to treat me for this problem? And if the person gives a very amorphous, nonspecific answer, my best advice would be to look for somebody else. There's a lot of great psychological treatments out there with a lot of research backing them for a lot of problems. And in the old days, there was kind of this one-size-fits-all view of therapy that come to me and I'll just treat you for everything. And like medicine has gone the way of specializing, so has psychological treatments. Just like your last guests were specialty in eating disorders. I don't see people for eating disorders because there are smarter people out there like your last guests who can do it better than me, so I would refer them. Mm-hmm. So you want to make that initial phone call, see if the person has experience, ask them to describe the treatment, and then talk about, once you get in the room later on, you talk about specific goals.
Our number is 1-877-698-3627. I'm Dr. Michael Aronoff, and I'm talking with Dr. Jeffrey Wood, clinical psychologist. Very knowledgeable and helpful for us to understand and weed through the plethora of therapies available and how to go about, if you feel that there are some issues, how to go about finding help and finding the appropriate help. Let's go to the phones.